Approximately 1 in 8 women in the United States will develop invasive breast cancer in their lifetime, and approximately 20% of these women will have HER2 positive breast cancer. It's a more aggressive form of the disease, known for putting its patients at a higher risk of recurrence. I'm joined by David Rosales, a certified nurse educator with Puma Biotechnology, who'll help us understand the HER2 positive diagnosis, and also Valerie Mitchell. She's a HER2 positive breast cancer survivor. Welcome to both of you.
Thank you so much
Thanks for being
us.
here. David, let me start with you. Can we talk a little bit, or just help us understand what a HER2 positive diagnosis means?
HER2 stands for Human Epidermal Growth Factor Receptor 2. It is a growth-promoting protein receptor found on the surface of all breast cells. In normal breast cells, the HER2 is responsible for cell growth, cell division, and cell repair. Yet in about 20% of breast cancer patients, the HER2 is not working correctly. It's overexpressed and amplified, which means patients like Valerie have a higher chance of this recurring, meaning the cancer coming back. And so this is an aggressive, very aggressive form of breast cancer.
Valerie, let me bring you in. Let's start with the journey. What happened? When were you diagnosed?
So I was diagnosed in April of 2016. I found a 4-centimeter tumor in my armpit, which is roughly the size of a golf ball. It was linked to a 2-centimeter tumor in my breast. It was invasive ductal carcinoma, HER2 positive.
When you heard HER2 positive, did you know what that meant?
Not at all.
No.
No, I just heard breast cancer, and it was a tornado of information. And when I did learn more about HER2 positive, it was scary.
What exactly did you do in terms of treatment? I know there's protocol when you get a breast cancer diagnosis.
I started with chemotherapy, which included trastuzumab, and then I had several surgeries, and I opted for a bilateral mastectomy because I wanted to make sure that I was doing everything to keep this disease from coming back, and I also had reconstruction. And then that followed with a series of radiation. The entire process took about a year. I was also part of a cancer support group, and it was a wonderful experience to have other women to be able to talk to who have been in my shoes and who could help me prepare for what to expect. But it was also scary because I could see women just like myself and even younger than myself whose cancer was coming back. And so it gave me the determination to know that I would do whatever it took, and I needed to stay on top of new developments.
And did you do that?
I did. I finished my treatment in May of 2017, and in July of 2017, I saw information about a new drug that had just received FDA approval, and the medication was Nerlynx. I went to my doctor, I was very excited about that, and I took the information and said, "Have you heard about it?" And she said, "I don't want to prescribe it." Thought about it a lot and knew I didn't want to live with any regrets, and so I made a decision to get a second opinion.
David, let me pick up from there. She mentioned Nerlynx. How is it used in HER2 positive breast cancer?
Well, Nerlynx is indicated, and when I say indicated, that means it's approved for use in early stage HER2 positive breast cancer as extended adjuvant treatment following an adjuvant trastuzumab-based therapy. I know that's a mouthful of clinical terms, but I'm going to explain what that is. Adjuvant therapy refers to additional cancer treatment after surgery. It may be chemotherapy, radiation therapy, hormone therapy, and targeted therapy. Extended adjuvant treatment is extending treatment for a period of time. For Nerlynx, it's extending it for 1 year in order to reduce the risk of the cancer coming back. Nerlynx demonstrated that it reduces the risk of recurrence in adult patients with HER2 positive breast cancer after treatment with a trastuzumab-based therapy. Most common side effects is diarrhea, but it can be serious. However, a healthcare provider may choose to start a patient at a lower dose for the first 2 weeks and increase to full dose in order to help manage this side effect.
So it's an added treatment, if you will, after what is protocol today.
Correct.
Valerie?
So I was on Nerlynx for 1 year following treatment, so it's been about 4 years since I've been on it, and I'm about 5 years out from my original diagnosis.
And are the tornadoes maybe less today?
Oh, significantly less. It's wonderful.
What would be your message to maybe someone who heard that diagnosis today, knows someone?
I would encourage them to know that they weren't alone, to get connected with other people that maybe could relate to their story. I would encourage them to advocate for themselves and to do their research, that it's okay to ask for a second opinion.
Absolutely. Thank you so much for your time, and thank you for coming in. Good luck to you.
Thank you.
David, thank you so much for the information. I appreciate it as well.
For more information, go to Nerlinks.com.
What is Nerlinks, neratinib tablets? Nerlinks is a prescription medicine used alone to treat adults with early-stage human epidermal growth factor receptor 2. It is not known if Nerlinks is safe and effective in children. Important safety information. Diarrhea. Diarrhea is a common side effect of Nerlinks, but it can also be severe. Diarrhea may lead to loss of too much body salts and fluid, which can cause dehydration. Your healthcare provider will prescribe Nerlinks in one of two ways to help manage diarrhea. Full dose of Nerlinks. Your healthcare provider will prescribe the antidiarrheal medicine loperamide for you during your first 2 months, 56 days, of treatment with Nerlinks and then as needed. A lower starting dose of Nerlinks. Your healthcare provider will start you on a lower dose of Nerlinks for the first 2 weeks of treatment and then increase you to a full dose Nerlinks regimen. Tell your healthcare provider right away if you develop diarrhea. You may be prescribed loperamide as needed. Always take antidiarrheals exactly as your healthcare provider tells you. Call your healthcare provider right away if you have severe diarrhea or if you have diarrhea along with weakness, dizziness, or fever. Your healthcare provider may change your dose of Nerlinks, temporarily stop, or completely stop Nerlinks if needed to manage your diarrhea. Liver problems. Tell your healthcare provider if you have liver problems. Changes in liver function tests are common with Nerlinks. Your healthcare provider should do blood tests before and during treatment with Nerlinks. Your healthcare provider will stop your treatment if your liver tests show severe problems. Call your healthcare provider right away if you experience tiredness, nausea, vomiting, pain in the right upper stomach area, abdomen, fever, rash, itching, yellowing of your skin or whites of your eyes. Pregnancy. Nerlinks can harm your unborn baby. Female patients should tell their healthcare providers if they are pregnant or plan to become pregnant. They should use effective birth control, contraception, during treatment and for at least 1 month after their last dose of Nerlinks. Male patients with female partners who can become pregnant should use effective birth control during treatment and for 3 months after the last dose of Nerlinks. Breastfeeding. Tell your healthcare provider if you are breastfeeding or plan to breastfeed. It is not known if Nerlinks passes into your breast milk. Do not breastfeed during treatment and for at least 1 month after your last dose of Nerlinks. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take medicines used to decrease stomach acid called proton pump inhibitors, PPIs. You should avoid taking these medicines during treatment with Nerlinks. You should avoid eating products that contain grapefruit during treatment with Nerlinks. The most common side effects of Nerlinks when used alone include diarrhea, nausea, stomach area, abdomen, pain, tiredness, vomiting, rash, dry or inflamed mouth or mouth sores, decreased appetite, muscle spasms, upset stomach, nail problems including color change, dry skin, swelling of your stomach area, nosebleed, weight loss, urinary tract infection. These are not all of the possible side effects of Nerlinks. For more information, ask your healthcare provider. Tell your doctor if you have any side effects that bother you or that does not go away. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see patient information at Nerlinks.com.